This video is based on the Collaborative Practice in Nursing document developed by the three regulatory nursing colleges in Alberta, the College and Association of Registered Nurses of Alberta, the College of Licensed Practical Nurses of Alberta, and the College of Registered Psychiatric Nurses of Alberta. My name is Elizabeth Taylor, Director of Regulatory Services for the College of Registered Psychiatric Nurses of Alberta. Presenting along with me are Pam Mangold, Policy and Practice Consultant from CARNA, and Glenda Tarnowski, Director of Professional Practice from CLPNA. The purpose of this video and the Collaborative Practice in Nursing document is to provide clarification and increase Alberta nurses' understanding of their contribution to collaborative practice. Today, we will explore concepts including a deliberate and committed professional approach to collaboration where respectful communication and decision-making is evident in practice. As nurses, we are aware that individual and shared knowledge and skills play a key role in improved care outcomes and enhance quality care delivery, client safety, and experience. And now, I'll turn it over to Pam to talk about scope of practice.
Thanks, Elizabeth. I'd like to begin by talking about scope of practice. In Alberta, the authority for nursing practice comes from legislation, regulatory colleges, employers, and clients. We are going to look at all of these levels of authority. First, let's look at government legislation. The main legislative framework in Alberta for health professions is the Health Professions Act. The Health Professions Act outlines the responsibilities of all healthcare professionals and their regulatory colleges. It defines a common framework regarding registration, discipline, continuing competence, and restricted activities. There are other pieces of legislation that direct health professionals, such as the Health Information Act. Nurses are expected to know and understand all legislative requirements applicable to their practice. It is the regulatory colleges that define for NPs, RNs, LPNs, and RPNs what they are authorized to do under their regulations. CARNA, CLPNA, and CRPNA are self-regulating professions that define the standards and code of ethics for their members. Nurses from the three regulated nursing professions have differences in entry-level education, scope of practice, knowledge, and skills. These differences need to be understood and respected. Nurses employed by an organization are required to follow the requirements and job description as determined by their employer. This is where scope of practice of nurses can be tailored to meet the needs of the population based on resources and supports available. For example, a nurse may be educated and trained to perform IV push medications. However, within a specific practice setting, this may not be supported. Therefore, the nurse cannot perform the intervention. And with any intervention, it must always be done in context of the client needs. Client safety, protection, and client consent are essential. Nurses recognize and support a capable person's right to refuse or withdraw consent for care or treatment at any time. Each nurse is responsible and accountable to follow best practices to ensure they have the knowledge to practice safely, competently, and ethically. Now I'll turn it over to Glenda.
Thank you, Pam. Now let's focus on collaborative practice in nursing as a foundation for quality care. Collaborative practice is a deliberate and committed professional approach to communication and decision-making that enables a professional practice culture. This is where nurses share their knowledge and skills to contribute to quality care, improved outcomes, and enhanced client safety and experience. There are many nursing care models, and it's important that whatever model nurses practice in, the focus is on collaborative practice principles that uphold ethical and professional standards of nursing care to promote safe care. In order to provide safe, competent, and ethical client care, nurses must practice in an environment that fosters collaboration between health professionals. Common practice values foster collaborative spirit, respect, and knowledge sharing, resulting in a positive professional practice culture. CARNA, CLPNA, and CRPNA believe that incorporating the following principles maximize client healthcare outcomes and effective teamwork. These include client-centered care, role clarity, trust and respect, communication, shared decision-making, and collaborative leadership. A priority of collaborative practice is to ensure clients are active partners in their care. The nursing care approach is evidence-informed and responsive to the client's needs with the goal of improving healthcare outcomes. This means the client's perspective is central to all decisions related to their health and well-being. Another important aspect of collaborative care is role clarity. Nurses are accountable and responsible for their own practice. Nurses are expected to practice within their individual level of competence and seek additional guidance when aspects of care are beyond their level of competence. When working in teams, nurses respect the role of all members on the team and acknowledge their capabilities and contributions. Nursing roles cannot be defined solely by a list of tasks. One must consider that many nursing interventions can be performed by the three nursing professions. When determining division and transition of care, the importance lies in considering client needs, individual nurse competence, and environmental supports. This emphasizes the importance of nurses understanding, trusting, and respecting each other's roles and expertise while working together in the best interest of the client. Collaborative practice requires a commitment to shared team values, building trust, and opportunities for nurses to share their expertise. Now Pam will expand on the importance of communication and shared decision-making in collaborative practice.
Thanks, Glenda. Nurses use effective communication skills to gather and share information at all times. Nurses use language that clients understand and engage the client in processes such as planning, shared decision making, interventions, and evaluation of care. It is critical in collaborative practice that nurses recognize the importance of addressing misunderstandings and use conflict resolution strategies to promote healthy professional relationships and optimal client outcomes. Nurses are reminded to work together to resolve interpersonal conflict and uphold the standards of practice and code of ethics that govern the profession. It is equally important in collaborative practice that nurses identify the influence of personal values, beliefs, and assumptions on their practice and work towards reducing bias. The opportunity to share expertise and decision making builds trust in professional partnerships and provides opportunity for collaborative leadership. Now I'll turn it back to Elizabeth.
Thank you so much, Pam and Glenda. To recap the information presented, collaborative practice is based on the foundation of client-centered care, open communication, mutual trust, shared decision-making, and accountability. Alberta nurses respect and value the knowledge and experience each unique nursing profession provides as part of the healthcare team, and work together to ensure collaborative practice is evident across all care settings. You can access the Collaborative Practice in Nursing document on all three college websites. If you have any questions about collaborative nursing practice, please contact your college at the emails provided on the screen. Thank you for watching this presentation on collaborative practice in nursing.